Well, this video is to tell you about my experience on the day of my LRTI CMC basal thumb arthritis surgery. I'm home now. I had to be there at 6 o'clock this morning, and my dear husband went with me. When I talked to the anesthesiologist, I had a whole list of questions for him and also for the surgeon who was doing the procedure. And I really liked the anesthesiologist. He made me feel pretty comfortable about everything. One of my questions for him was, I had read that for this procedure, sometimes they do a nerve block, like they block the whole arm. They deaden basically the whole arm, so that even if you woke up in the middle of surgery, you wouldn't feel anything because your arm would be dead pretty much. And I had heard that people have nerve issues with that. And so if they were going to do it, they for sure would need to use ultrasound guided putting it in. And so I asked him about that, if he was planning to do it and if it would be ultrasound guided. And he said he certainly could do that. But I told him about 15 years ago when I had terrible, terrible nerve pain in my right arm and ended up having cervical spine surgery to get the pressure off those nerves that was causing this for a whole month. And that nerve pain, oh, there is nothing worse. And I did not want to risk that happening again. And so ultimately we decided that the other thing I didn't want is to any chance of waking up in the middle of the surgery, because I had read about that happening to somebody. And so since I didn't want that to happen and didn't want the nerve pain, we together made the decision to not do the nerve block thing at all, but to use general anesthesia instead of a deep twilight. So I did that. And when I came out of it, that was the worst thing about having general anesthesia, because I had a really hard time. I felt awful coming out of it. I was in recovery for 2 hours, Dave says. I don't really remember. All I know is when they were pushing me to go home, I didn't want to. I didn't feel ready to get up or anything, but they got me out of there after 2 hours. Normally recovery is 30 minutes after this. But my heart rate was dropping really low, even though I have normally a low heart rate. It was dropping low, and my respiration was super, super slow, and they had to keep telling me to breathe. And I would realize, oh, I haven't breathed, have I? And then I would breathe, and so I was trying to do block breathing and trying to think about breathing, but they kept on saying, breathe, breathe. And I heard them talking about the low heart rate. I kind of remember that. But I guess it got into the 30s or something like that, but it was really slow. Anyway, it wasn't fun at all coming out of the anesthesia, but I got out to the car, and fortunately I had a barf bag with me because I made use of it on the way home and felt quite a lot better afterwards. So he had said that a lot of people say that once they throw up, they feel better, so I did. And then we got home, and I'm on this couch situation. Dave helped me set up my arm on this pile of pillows and wrapped a blanket around it to hold my arm up, because the elevation pillow thing that I ordered from Amazon comes today, and it hasn't come yet. It's about 4:15 p.m. now. We got home around noon. And so basically when I got here, I slept. I was out and slept about 4 hours, and I feel much better now. And I just got up to go to the bathroom, and when I was in there, I was turning my hand like this to look and feel these fingers, which you see are free. I'm not supposed to move my thumb at all, but they said I can move these fingers, but they're fat, like sausages. They feel swollen, and now they're starting to be really tingly. They were numb before, but I'm starting to feel pins and needles in them, so I'm wiggling them. But I had, sitting in the bathroom, I turned my hand to look at the front of my hand, and a terrible, sharp pain just came and was all up and down my forearm inside, just like it was on fire. And oh my gosh, that was so painful. And I thought, I am not moving my arm again. So I'm back in here. It finally subsided. It came and then subsided. Thank goodness it subsided. And I said to Dave, I think we need to get to the pharmacy because I'm going to be using those pain pills. I don't think it's very strong pain pills. She said if it's not enough, I could call and get something stronger. I forget what it's called, what I'm getting. But right now, sitting here, I don't have a whole lot of pain. I just have kind of a general ache and these weird pins and needles in my fingers. But so far, that's day one. And my wonderful, wonderful husband made some broccoli cheese soup for me, which I haven't eaten yet, but I'm looking forward to that. And apparently my Corey and his daughters are going to call me so I can see my granddaughters on FaceTime. That'll be fun and nice time. So that was day one.